Hi everyone, we're here with Andrew today, and following on from our patient review from last week with Sarah, she came in with some symptoms and pains which we spoke about, but mainly she came in with fibromyalgia. So today we're going to speak to Andrew about fibromyalgia, what it is, the kind of typical symptoms that are associated with it, and how we can help you. So over to you, Andrew. What is fibromyalgia?
So fibromyalgia is a diagnosis made, specifically the criteria behind fibromyalgia is you have fatigue and you have a certain amount of tender points or painful points in your body. I think it's 18. There's no actual blood test diagnosis or MRI scans or anything like that. It's particularly given to a patient, I believe, as a GP, but given to a patient when they've come in a lot of times, they're fatigued, they're not getting better, they're in pain, and the GP, in a way, is not sure, but it's a bit of a misnomer diagnosis because there's no tests. I'm not saying there isn't a problem, there certainly is a problem with that patient. And seeing a lot of fibromyalgia patients, a lot of chronic fatigue patients, they all resemble the same sort of thing in the sense of their body is not dealing with stress very well. So from a young age, often these people have had stress from a young age, meaning maybe there were forceps, maybe they had stresses as a young child, maybe they had some emotional stress or this accumulation of emotional, physical, maybe they haven't eaten very well, maybe they really didn't respond well to some medications or some drugs or sweets or whatever, and the accumulation of all these stresses, maybe they had a whiplash when they're young, etc, 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 and their body just can't heal, can't function. They're fatigued, they've got tender points, they've got gut issues, they've got reflux, they've got bloating, and we see it all the time. In fact, most of our patients we see here have some sort of those symptoms anyway, such as reflux or gut issues or IBS and constipation and fatigue, because most of the patients are chronic. They've been to the GP, they've been to physios, etc., so they come to see a chiropractor. Now, the way we've set the clinic up is very functional based. We do a thorough examination. I particularly, and a few of my colleagues, really delve into getting the gut fixed, getting the brain fixed, which ultimately brain and gut is the most important system in your body. And those patients really need that sort of thing. Obviously their body's been struggling for quite a long time, so they do need a bit of planned strategy over a certain length of time to really get them those better. We have really good success with them if they can stick with the plan and stick to our advice in terms of treatment. I know a lot of this myself because I had all these symptoms. I really struggled myself with gut issues and fatigue and all that kind of stuff. My mum had ME diagnosed because she immigrated from England and she was looking after me, a teenage boy who used to buy air rifles and shoot squirrels and bunk up school and all that kind of crap. I had all these things. I had glandular fever, I had Bell's palsy, I had trying to play tennis in the States, kept getting injured, neck problems, shoulder problems, gut issues, constipation, and I know it. I know because I've gone through it, so I know how I can really help people with these kind of conditions. So fibromyalgia, ME, chronic fatigue are things we see all the time, and I've gone through a lot of education on functional neurology, functional medicine to really understand what people are going through and why. So as long as blood tests have been ruled out, as long as MRI scans, there's no sort of tumour or cancer or any red flags, pretty much we have the green light to really, really help people improve. A lot of the time, a big part of it is the neck. The neck is jammed, it's close to the brain, and a lot of it is a leaky gut, and the gut is not well, and the brain-gut axis is out of sync.
And so what would be, say, your top 3 kind of tips into how to increase your quality of life and kind of your lifestyle, and so that you're reducing the onset or potential risk of, fibromyalgia?
So to allow you to be more adaptive is probably your question, is to be more adaptive, to allow your body to be healthier. Obviously it's the obvious things: go to bed early, get your sleep, that's huge. Eat a very healthy diet. Obviously Easter's coming up, you can be a bit naughty, but try and eat a paleo type diet where the food is good quality, it's natural, it doesn't come from cans and wrappers, all that kind of stuff, nothing artificial. And then keep your body functioning, such as yoga, Pilates. A lot of you need a chiropractic, functional chiropractic assessment to get that going, but once the spine is doing well, get into Pilates and yoga. So if you sleep well, if you eat well, and you get your body working well, that's really huge. Other things that are very important are vitamin D drops, because in the UK we don't see the sun much. Exercise, mindset, Wim Hof, I talk about Wim Hof quite a lot, the breathing, etc. And those are things that can help you massively. So those are my tips for those type of patients. But I would say fibromyalgia patients definitely need a doctor of health. We should have two doctors. We should have one for crisis care that you go and see at A&E and your GP for things that could really cause damage to your health, and then a doctor for illness and a doctor for health. And what we do here is really try and get health back into the system. We do a thorough examination, look at all types of different things. So I think patients should come and get a full assessment, and then they can decide if this is for them or not. But I believe looking at our reviews and our patients and our videos, we can help everyone with the spine.
Yeah, fantastic. Well, thanks so much, Andrew. And if anyone else needs any help, if anyone's got any questions, either just ask us on Facebook or give us a call on one of our clinics, and we're all more than happy to help.
Thanks, Leo.